Morning, everybody. Can you hear me at the back? Yeah, loud and clear. Thank you. Ko Sheila toko inua. Kei te toka tu mai ahau e mahi ana. My name is Sheila Fowler, and I work for the ADHP, and I'm the National Coordinator for Shaken Baby Prevention. So don't be disappointed that Patrick Kelly is not here. I think we are his best team, I think. So just to give you a little bit of overview, I'll be talking to you a little bit about abusive head trauma and Power to Protect. That is the Shaken Baby Prevention Program. So, as you know, shaken baby is actually not the diagnosis. The diagnosis is abusive head trauma, and we have to use a definition in order for us to diagnose a child that has been shaken. So the universal definition of abusive head trauma is an injury to the intracranial contents or skull of an infant or a child younger than 5 years old due to blunt impact and violent shaking. And later on, the CDC added suffocation, strangulation, and injuries from dropping or throwing a child. So that is the universal definition that we use here in New Zealand as well. So what is abusive head trauma in New Zealand? At the moment, here in New Zealand, it is the #1 cause of head injury in under 2s. We have 20 to 30 babies that we admit every year here in New Zealand. Their average age is 4 to 5 months, and some of them are injured on their first month of life. 30% of the presentation in ED are missed on their first presentation, and only 1 out of 150 are recognized head injury. And the tip of the iceberg is 1 in 5 will actually die. So we do have an ethical and financial responsibility here in New Zealand to reduce the incidence of abusive head trauma, but because you can see it's $11.7 million per child, that's a long-term cost that we actually pay. Okay. So this is the comparative study that Dr. Patrick Kelly has done. They've collected the data from the 20-year referral to child protection team, and as you can see on the graph, there is an increasing incidence of abusive head trauma in New Zealand. So what are the symptoms? Most of us are health professionals here, so I won't go through in depth, but as per definition, there is subdural hemorrhage, that's bleeding in the brain. And just a few slides. These are actual slides or actual CT scan from some of our cases. 80 to 90% will have retinal hemorrhaging. I just pointed it out, some arrows there. But if you actually look closely with this ophthalmology scan, you can actually see that there's a lot of retinal hemorrhaging there, like the whole back of the eye. The white spot there is the optic nerve. And fractures, unfortunately, skull, long bone, and rib fractures are common findings in abusive head trauma. And that's a fracture there. And let's not forget, 50% of those kids admitted or presented to us has got no external injury, and this is why we have to be vigilant when we're actually seeing patients with abusive head trauma or suspected. So risk factor, I'm not going to go through the whole anatomy of the baby, but the baby is the #1 risk factor. Why do you think that is? It's because the baby is small, the baby's large head to body ratio. They've got small neck and weak and floppy neck, so they can easily be picked up. And also their brain is still developing. So it's the forces of acceleration and deceleration that actually causes the veins between the spaces of the brain and the skull that actually burst and cause subdural hemorrhaging. So that's why they are the #1 risk factor. There are individual risk factors, familial risk factors. I think most of you are already aware of this. There's community risk factors, and the other risk factors is frustration or intolerance. So just to give you a little bit of an example of the recent case review, and I know that you are all our GPs and GP nurses, so I've chosen a case review that involved a GP. So this 8-week-old baby presented to the GP with a mom due to seizures. On arrival, the GP had a look over and then realized that this is actually an emergency. So the GP did an emergency measures and then called the ambulance and transferred to Starship. So on arrival in the hospital, there was no visible signs, no bruising, no anything. On CT, there's subdural hemorrhage plus skull fracture. On X-ray, they saw multiple rib fracture, long bone fracture, and fracture to the toes. And in ophthalmology, this baby has got bilateral retinal hemorrhaging. So now this baby is 2.5 years old, developmental delay, still having seizures and still on medication, is still uncontrolled seizures, and cognition of 1-year-old. So this is why we are seeing, this is why we said it's 11.7 million is the cost, long-term cost, because it doesn't stop from when they were admitted. So this child is under Oranga Tamariki care, and in fact, this child is still ongoing, isn't it, Savannah? This child is still ongoing case for us. So this is where we come in. Prevention is always better than cure, and you know, with every risk factor, there are preventative factors as well, and the number one preventative factor that we can actually offer is education. The Shaken Baby Prevention Program, part of this is actually teaching parents what is normal crying. And this is from the National Shaken Baby Syndrome Center in Utah. Babies cry from 2 weeks and it rapidly rises to 2 months. And that 2 months, they can cry up to 5 to 6 hours. And we need to actually tell them that this is actually normal crying for babies. And the thing is, this is actually coincide with the shaken baby or abusive head trauma cases that we have, is almost in the same time as well. So we need to make them understand that crying is normal, and sometimes there's no reason. You've checked everything, and there's no reason for crying. We also teach them the purple crying. P is for peak of crying. As we said, from 2 weeks, it rapidly rises to up to 2 months to 5 to 6 hours. Unexpected, because they can just cry for no reason. And they resist soothing. R is for resist soothing. And so you can do anything and everything, and there's nothing you can do about it, and they're still crying. They cry with a pain-like face. That's the P for purple. And it's long-lasting, as we said, 5 to 6 hours. And unfortunately, it happens when you're very tired. It's late afternoon or early evening. So this education is actually, it's called the period of purple crying, and it's developed in the National Shaken Baby Syndrome Center in Utah. They call it period of purple crying because period means there's a beginning and an end. So we need to actually reiterate to the parents that there is a period and there is an end on the crying. So what is the Power to Protect program? So this is developed in ADHB and specific to New Zealand. There are all 20 DHBs are actually involved in the Power to Protect program. We deliver education. So what I do is I visit all DHBs and deliver the education strategies, and then the healthcare providers actually deliver it to the parents. And we teach them how to cope with crying. We have a crying checklist. And we have 6 simple but powerful messages, and that is, it is normal for babies to cry. We tell the parents that it is normal for babies to cry. It is normal for us to be frustrated. I don't know about you. I'm a parent, and I have been there, and I know how it is. And I was also a pediatric nurse, both in counties and in Starship, and I know how it is when babies crying. It's okay to walk away, and these are the things, some parents, they think they have to actually hold the baby while the baby's crying until the baby stops crying, but actually that causes the frustration. And so we actually have to tell them and say, hey, it's okay to walk away. Put the baby in a safe place, have a cuppa, calm yourself down, and then check the baby later. This actually really resonates to the parents and caregivers as well. And of course, we tell them about the dangers of shaking a baby and what it can cause to a baby. And we actually tell them that it can only take 5 seconds for the irreversible damage to occur when you shake a baby. And never ever leave the baby alone with anyone whom you think you might lose control. Some of the data that we have collected, the perpetrators are actually not related to the baby, or it's like a stepfather or a boyfriend. And share this information with everyone. And if you think the baby is injured, seek medical help at once. So these are just the resources. You guys in the GP space, you can actually order online Health Ed. It's free. It's free for you to order, and it will be delivered for you for free as well. So there's no cost. So there's no reason why you can't have resources. I know that a lot of us are not using DVDs anymore, but we're still producing DVDs. And the last time I checked the orders, there are still 200 in the country that actually order DVDs. I don't know where they actually put it in, but yeah, it's still there. There's also a video about Shaken Baby, and Dr. Paykel is actually there. So, if you have the chance, as you know, we only have 10 minutes each slot here, so I don't have time to actually show you the video. So go to YouTube and just watch Power to Protect video, and you will actually see we have actual case there on that video. And thank you very much for your time. I think that's my 10 minutes.